Okay, so today we'll be discussing calculation of a safe dose medication by weight. Ceftriaxone 500 milligram IV daily is prescribed. The child weighs 15 pounds. Per pharmacy, the safe dose is 50 to 75 milligram per kilogram per dose. Is this prescribed dose safe for the child? So the only question is asking, is it safe? So the question is a yes or no. It's safe or it is not safe. But in order for you to find out if it is safe, you need to work the math out. So I'm going to pick out a couple of things because sometimes you see some med math and it have so much numbers inside. You wonder what is it that you need to know to or to use to work the maths out. So dose order is 500 milligram via IV. Then the child weighs 15 pounds. The safe dose is 50 to 75 milligram per kilogram per dose. And what is it asking? It's not asking you to calculate what dose the patient is going to get, because we know they're going to get 500 milligram IV daily. It's asking, is the prescribed dose safe for the child? So the first order of business here is to change pounds into kilogram. And the reason why I know that I need to change pounds into kilogram is because it says 50 to 75 milligram per kilogram per dose. So I know that I'm going to change it to kilogram. So that's the first order of business. So 1 kilogram equals 2.2 pounds. So to find out how much kilogram or how many kilogram this child is, it would be 15 divided by 2.2. And that will give us 6.82 kilograms. So the child weighs 6.82 kilograms. Now, this is a range, 50 to 75. So I have to work out the range. So what I'm going to do, I have to work out 50 first. So with 50 milligrams times the pounds, 6.82 kilograms. Because it says for every 1 kilogram, this is what this means. For every 1 kilogram, you give 50 milligrams. That's what this means. And that would be the dose. So instead of saying this, instead of saying 50, 1 kilogram, 2 kilogram, then will be 100, 3 kilogram, then will be 150. Until we reach 6.82. You don't need to do all of that. You multiply 50 by 6.82, and then you'll get 341 milligrams. So the minimum will be 341 milligrams, right? So let's work out the 75 milligram now, because we're looking for a range, because it did give us a range. So it'll be 75 times 6.82 kilograms. That will give us 511.5 milligrams. So the range is, according to the child's weight, the child can get up to 341 milligrams to 511, or we can say 12, we round it off, we can get 12, okay? Milligrams. So is this dose safe? Is this dose safe? And yes, it is, because it's between the range.
512.
All right. Any question on that?